I'm Dr. Monica Gomberg, and I'm the Vice President of Clinical Care and Endocrinologist at Blue Circle Health. Blue Circle Health is a free program for anyone who can benefit from it. If you live with type 1 diabetes, we are here to provide you the clinical care, the support, the education that you might need, and we can do it in the way that you need it in your life at this time. I went to medical school to have long-term connections and care with the patients that I serve. I loved the concept of being part of somebody's life and part of their journey and walking it together. And so I always knew that I wanted to deal with chronic disease management. I didn't want to see somebody once and never see them again. I feel like it's a privilege to be let into their life and to learn their daughter's name and to have their mom come to an appointment and to really have that be part of what we do together and understand that everything that they do is impacted by whoever's in their life. And so you can't take them in isolation. You need that. And that's what I loved about chronic disease management. And so really focused in on that. And I came upon an endocrinology rotation and I immediately loved what was happening because I love that you can make a connection in that chronic disease route, but also make a connection in something that the patient has to deal with all day, every day. It's something, that they think about, that they're constantly having to think about and having to manage. And it just felt like it was something that I could connect with and that I could, be able to stand by them and be there for questions and also, learn from them. And everybody's different and every journey's different. And so it was something that I was able to learn and constantly grow with. There's not one journey, right? That everybody's has their own journey. And everybody's day is different despite eating the same thing, doing the same activity, whatever it might be. And so I just felt that it was something that I was able to constantly learn from and learn with my patients. And I loved that part. It's never boring, of course, but it's always just really fulfilling and interesting. And I just feel honored to be able to do this with my patients. So I joined Blue Circle Health a little over a year ago, in early 23. And I joined because I knew that we could do better. We, meaning the healthcare system, can do better for our patients, for our providers, for really everyone as a whole. I came from private practice, which I loved, and I cry missing my patients. But I felt like I could only do so much. I could provide samples to patients. I could fight for prior authorizations, but I was in the grind every day, as were they. And I knew that they deserved better, and I wanted to try to find a solution. And thankfully, what I was imagining in my head was being built by Blue Circle, and it was the most incredible find. And so I jumped in wholeheartedly, and I've just been so grateful to be here, to be humbled by this journey, and to be able to offer this opportunity to the world, really, and show everyone that everyone deserves this and that we can do it and make it happen. So an endocrinologist would be a great asset for any patient with diabetes. And I really believe that because what an endocrinologist does is they will come in and assess where you are and how you're feeling and what your goals are in relation to your diabetes management. And I say that very broadly because for some people, it is specifically talking about their A1C, sure. And for other people, it is not remotely related to a number. Maybe it's about fear of complications. Maybe it's about fear of hypoglycemia, whatever it might be. And so an endocrinologist will come in and figure out what your goals of care are and also make really important recommendations and advise you on the ways in which we can prevent complications in our life and really thrive and live a very long, healthy life with type 1 diabetes. And so it's somebody who is an expert in diabetes care and also has the knowledge of many other disease types in order to make sure that we're not contradicting something, that we're not causing complications in something else. The beauty of working with patients in this realm is I may have medical recommendations, and I will have medical recommendations to keep people safe and to provide guidance. But that's where it ends, right? The journey is the patient and what they want and choose and need to deal with on their own. And so I think that my role is to say, here is a recommendation and here's why. And the patient can decide what they want to do with that and how they want to do with that, and really take it upon themselves to choose their journey with that. And I love that so much, because it's not ever about me. It is always about the individual patient in front of me, and how I may recommend a 2-unit insulin change for patient A and 2 units for patient B, and 2 entirely very different things happen. And so I think they're able to take my recommendations for themselves and do what they wish with it, but also just feel that they can take on that role of making changes. The other thing I really love about it is I can make a recommendation to a patient and they can take that and grow with it, right? Like, I don't want to say, here's the exact dose change that you need. I might say, what's your goal here? Is your goal to, do X, Y, and Z with your blood sugar numbers? Is your goal to have this activity with your daughter and not go low? Okay, let's get you there. And here would be my recommendations to do that, and take it to the next level. Here's how to self-adjust if you want to. Here's how to make that phone call to make sure you're getting your insulin from the pharmacy. Here are the things that you can do, and I'm here to play support. I'm backup. Everyone's really individual, and we say that because we create an individualized care plan for every patient that walks through the door. And so that can mean any number of services, a lot of services, one service. It doesn't matter, whatever it is that you need in your life at this point in time. And so if endocrinology is part of that, I'm very honored to be part of that. The other role really that I can serve is that patients might have an endocrinologist. And I'm so thrilled about that, because I want everyone to have an endocrinologist in person. I think it's really helpful in so many ways. But if you have an endocrinologist, I don't need to serve that role of replacing that. I never want to replace that. You have a wonderful medical team already. Where I think I come in is the different programs that we have at Blue Circle. I want to make sure you feel supported in what we're doing. And so that's where I would come in, meet with you and say, let's make sure that this is the right thing for you and get that ordered. In the meantime, see your regular endocrinologist. You're in great hands. And so I can serve both of these roles independently. And I love doing both of them. And I think people benefit from both in either way that they need in their life. One of the really critical things is making sure that people understand what other things outside of the endocrinology room do need to be addressed with diabetes. And so talking about seeing an eye doctor, doing a foot exam, getting blood work done, and why we're doing that blood work and what that might look like. Those are the things that I like to make sure that patients understand and that we address in every appointment. We fit into your medical home. We don't replace the doctors you have. We like to support you and to support them. And so you define what you need from us, and we're here to help with that. We're not one size fits all. We're here to figure out what it is that you need and get you connected to that service or program or thing in your life that is going to be most helpful for your diabetes. I think it's very important for us to acknowledge that every journey is different and that every patient needs different things. And so for one person, they might not know how to navigate insurance companies. I don't know how to navigate insurance companies. I'm learning every day. It's a very complicated process. And it's something that when you're on chronic medication, you need to deal with every single month. And so we want you to feel empowered dealing with the systems, the people, the physicians, the programs, everything along the way related to your type 1 diabetes. We hope that everybody feels fulfilled with their time at Blue Circle, and we will work our hardest to make sure that we are here for you during that time. The most important thing, and the thing that I would love, that our team would love the most, is that by the end of your time, by the end of your 6 months, or sooner if that's your goal, would be for you to feel empowered and for you to feel like you're standing in power with your diabetes.